Hello, we are with Dr. Elisabeth Sheff, a polyamorous expert. She's a consultant and legal expert with polyamory clients and people who practice that lifestyle. And we want to ask you a couple of questions and a couple of get a couple of ideas about your experience as well as all of the research that you have done.
Great. Thanks so much for having me on.
Yeah, thank you for being on. So first of all, you've written several books. The Polyamorous Next Door, what is it? Tales of the Polycule?
Stories from the
Stories.
Polycule.
Yeah.
And then the third one is When Someone You Love is Polyamorous.
Right, which kind of mirrors When Someone You Love is Kinky, right?
Yeah.
Yeah, which is so needed because, as a therapist in private practice, you all the time get clients, couples who one partner wants to launch into, either kink or poly or open relationships. Another partner is more reticent or says, no, that's actually not for me. And so that's really good information to be able to read about. So in all of your research, what are some of the key points that you found when working with this population?
I would say maybe the most important finding for me is that these families can provide, polyamorous families specifically, can provide healthy and loving and stable and supportive and appropriate
Mm-hmm.
family environments for children. I've been studying this group of families for the past 20 years. And right now I'm in my fourth wave of data collection, talking to the kids of these families, some of whom I met when they were preschoolers, and now they're in college. Talking to them about how things go for them, having grown up in these families. And in general, they are in great shape,
Mm-hmm.
these kids. And there's a few reasons for that. Some of it is race and class privilege, that a lot of their parents are white, highly educated, middle and upper middle class people. So it's easier to be in great shape when you have a social privilege.
Mm-hmm.
Um, Also, I think the wider social safety net that they grew up not only experiencing and soaking in all that love and support, which is generally quite a bit, um, but also building skills, figuring out how to recreate that. So when they leave home, they are not necessarily establishing lots of polyamorous relationships. They may or may not be polyamorous. A lot of them are not sure. They're like, I don't know, we'll see.
Mm-hmm.
But they are establishing emotionally intimate networks.
Mm-hmm.
When they leave home, they've got the skills to create emotional intimacy wherever they go. And they report that as probably the most important thing they learned from their polyamorous family. Not a lot of emphasis on sexuality, which I find really interesting. That this is another important finding, I guess.
Yeah.
Number two, or maybe number three. Maybe the skills thing was number two. I'm not. I lost count. Or it could be all one giant finding, depending on how you break it up. um, but that sexuality is not the focus of their lives or their relationships. It's part of their lives. And in fact, it's a pretty fluid part. A lot of them identify as pansexual, even if they haven't necessarily had same-sex interactions or transsexual interactions, or, even if they've had mostly other sexual experiences, they still have that fluid orientation towards, we'll see what happens. I don't know. I'm 17 and I'm checking out the world, they're not making solid decisions about how their relationships are going to look for the rest of their life, which makes sense because they're 17 to 23. You know, it's hard to decide at 23.
Right.
Although some people do, but a lot of these folks are not that interested in putting labels on it. They're much more like, I'm doing my thing, and that could be monogamy with this person in this case.
Mm-hmm.
It could be with that same person, non-monogamy in a different, you know, or non-monogamy with everybody. Or I've also had some respondents decide that they were asexual.
Mm-hmm.
And so when I would ask them, do you see yourself being polyamorous in the future? They were the most certain that they would not, because they did not see themselves having any sexual relationships in the future. But they definitely saw taking those skills from the polyamorous family setting and translating them into a network of emotionally intimate relationships
Mm-hmm.
that they saw sustaining them through time in a different way than not really expecting a partnership to sustain them emotionally. So that was a lot. Should I keep going, or did you want to have a follow-up question? Or
That was a lot, and thank you for explaining all of that. I wonder, whenever you are conducting research with polyamory clients, people, what have you found the most helpful in terms of how you translate it to working with your clients in your consulting business? Like, what pieces of information do you find the most helpful whenever you actually go into the field, right?
you know, I don't tend to take information from clients into the field.
Right.
I tend to take it the other direction, that I've had this 20 years of experience, and then when people are looking at a specific situation,
Right.
because these situations recur fairly frequently, the same kind of situation, that, for instance, people start looking for a bisexual woman. They start as unicorn hunters and they get frustrated. That's a very common situation.
They start as unicorn hunters.
Yeah, so a unicorn hunter, unicorn hunting couples are people who come to the polyamorous community looking for a free-floating bisexual woman to add into their existing couple who wants to have a threesome with them, but won't be bringing in other partners of her own, won't be bringing in children, you know, is pretty much folded into their existing relationship, and they don't change that much in relationship to her. She's added into them. And that's a very specific orientation that comes from a monogamous mindset of, she's a sex toy that we're playing with and then we're done with her, but it's not a real relationship. Or maybe they're even looking for a real relationship and don't realize that coming to the community with this laundry list of what they want, you know, this bisexual, no kids, no other partners, come be with us, we want all of this from you. What is she getting out of it? Why would that laundry list of what you're going to do for us, you're going to help take care of the children, you're going to move to our farm in North Dakota, you're, you know, like all this, you're going to fold into our lives, but what's she getting out of it? Totally unclear.
Right. And that's why, you know, I understood it to be called a unicorn, because it is a mythical creature.
Yes. She is so rare as to
Not
be
to
mythical, precisely.
Yeah. Not to say that it doesn't exist, because surely it does exist, but it's definitely, there's definitely a lot of pieces that you have to take into account whenever you're looking for your special unicorn.
But it's so common. So many people want it and then run into problems with it because, hello.
Yeah.
But that because, hello, it's not clear. If you've never done it, if you've never thought about it, it's only that obvious to me because I've talked to people about it for 20 years. So I can say that happens all the time. Here are some common responses and here's how they work out.
Right.
In your situation, you might consider doing this, like these are some strategies. With my clients, I'm different from a therapist. I'm not a therapist. I'm not trying to figure out what the root cause of your relationship with your mother, how does that tie in with you wanting to be polyamorous now, or not getting your early needs met means that like, those are good things to know about yourself, and that's a really good reason to go to a therapist. As a coach, I'm much more focused on information and strategies, like identifying what do you want to do and how can I help you do it. What you want to do is try non-monogamy in a way that doesn't explode your brain. I can help you do at least minimize the fallout from the explosion. I don't know that you can try non-monogamy without exploding your brain at least a little bit. But I can help you keep the pieces together, you know? So I take a lot of very specific experiences from long term and watching them start, see how they go, and then watching it at the end. That gives a lot of information too. One of the main things I've learned from all of that is that the sex is not enough. Sex is good. Sex is fun. If you have fun sex with people, that is great. And it's not going to be sufficient to maintain a long-term, emotionally intimate relationship, polyamorous, monogamous, whatever, serial monogamy, whatever you're doing. And people are oriented, I think non-polyamorous people think of polyamory as so sexually focused and so hypersexual and all about the sex. And what really stands out to me from my research is that it's the emotional relationships that make it work or not.
Sure.
And if those emotional relationships are not taken care of, the sex is irrelevant almost. You can have fun with it and it can help patch things up for a little while, but it is not going to be a long-term solution to a relationship that's not working.
Right.
So I made up a word for those emotional connections. Polyaffective are the emotional connections among polyamorous relationships. Because sometimes when you have a polycule or a network of people, you'll have people who are kind of involved in the same relationship, but they're not actually having sex with each other. They're having sex maybe with the same person, but they're not partners, or their partners are partners.
That's the V, right? If you have one person.
Exactly. The V, or the whole big molecule, all sorts of side sprouting.
Yeah.
And it's that larger constellation of relationships that sustains the sexual relationship across time or breaks the sexual relationship up.
Right.
Even if the sexual relationship between one of the dyads is good, if the larger emotional constellation is not working, it's not going to work as a long-term polyamorous relationship.
Sure. That makes a lot of sense. Because the Sexual Health Alliance has the mission of educating general therapists and medical and healthcare practitioners, I'm curious about maybe a couple of things that are really important for those types of professionals in working with this population.
I have a little bit of data having worked with Rami Heinrichs. I'm not totally sure how to say her last name. She did her graduate work on polyamorous clients who've sought mental health care treatment. And those data indicate that when polyamorous clients are shamed and kind of bullied in a therapeutic environment, when they experience therapeutic bias from the practitioner, it has a hugely negative effect on them.
And one example of that would be, a person or a couple comes in and they say that they're in a polyamorous relationship and they're really, really struggling, they're depressed or something's going on, and the therapist says, well, it's probably the polyamory relationship that is the problem. You just need to stop that, right? That's a really common thing that I hear from other therapists. And
absolutely.
Bias.
And it's really painful for the people to be on the receiving end of that, and confusing and not helpful, actively damaging, which is the opposite of what you want from mental health care.
Right.
So I would say if you can't face and contain your pro-monogamy bias, if you have such a strong pro-monogamy bias, you need to face it and refer out.
Right.
If you can't, and monogamy is such a touchy subject for people. If your parents cheated on each other, if your spouse has cheated on you, if you are cheating on someone right now, you might not be able to contain your own biases about, oh, that is fucked up. You can't do that. Any kind of monogamy is wrong because it's hurtful. If that's your only, you've got tunnel vision about non-monogamy is wrong because of your own past experiences, then refer out. Don't hurt your clients and don't torture yourself, like refer out. Find someone else within the Sexual Health Alliance who has those skills. And I wrote, in fact, a couple blogs on this on my Psychology Today blog, detailing these findings. So you can link to the article from there, detailing therapeutic bias, the experiences of the clients who had therapeutic bias, and then who experienced therapeutic bias, and then ways for therapists to avoid therapeutic bias. For instance, recognizing that monogamy is one way to do things, and it's popular, and some people are very attached to it. But it's no more mandated. It's certainly not inbred into us biologically. We are not, or we wouldn't need so many social rules to reinforce it. If we were biologically monogamous, we wouldn't have to spend so much effort trying to be monogamous. We wouldn't have so many rules about not having sex with other people. It seems like as a species, we enjoy sexual variety. We want to see what's under that little grass skirt, or, So
that's a big idea. Yeah.
If your cultural bias is monogamy is the only way, you have a religious or a personal or a whatever, maybe monogamy is the only way for you. And that's totally fine. But it's hurtful to your clients to assume that it is for everyone, and that if they just would be monogamous, then it would fix everything.
Right. So in kind of what we are wanting to do in offering really specialized training to not only general clinicians and healthcare providers, but also all sexual health professionals, and anyone who wants to learn more about this, what pieces do you, just off the top of your head, know that this is going to be really important for them to learn, right? To really, because it's one thing to be like, oh yeah, I'm open to working with clients in this type of relationship or patients in this type of relationships, but that's often not enough, right? You really need to do your own research and explore your own biases, as you just referred, talked about, and do the work and gain the education necessary. And so what are just a couple of pieces that you think that would be really necessary for them to learn?
I would say that both in therapy, possibly, but certainly in conventional society, there's this idea that if you're experiencing jealousy, something is wrong, something has to change, something has to stop. And that is very common when people try consensual non-monogamy for the first time. They often do experience jealousy, and it's hard and it's painful and it can be really uncomfortable. And the knee-jerk reaction is, okay, that's got to stop. This relationship, whatever out there that's making me jealous, that has got to stop. An alternative reaction is to develop internal skills to feel the feelings of jealousy, live through them, manage those feelings. So for therapists, I think if people are coming to you and saying, oh my God, I'm experiencing jealousy, how do I get my husband or wife or partner or whoever to stop seeing this person?
Right. Therapists or coaches, right? I'm sure people that come to coach for that too.
A more useful thing might be to say, how are you managing the jealousy? Is this, and are there other good things about it? Is it worth trying to, let's do a pro con, you know, is this, are you getting anything out of this, or is this only hell? And how long do you think, what can we make the hell better?
Right.
Maybe purgatory, maybe even, you know, like earth. And can we lessen the negative impacts and we cultivate the positive impacts to see if it's going to work, see if it's worth the effort, or maybe this configuration is not working. Maybe this relationship is not working. Maybe polyamory is not working, but you can't know until you can tolerate your own internal experience.
Right. Exactly. So even as, you know, a sex therapist who specializes in non-traditional relationships, polyamorous and other types of alternative sexuality relationships and clients, we have to be careful that we aren't biased toward this is the way that you need to go.
Right.
That's kind of what you do.
Because polyamory is not for everyone. I would say polyamory is really not for most people.
Right.
I would say most people would be much more comfortable with, for instance, a monogamish relationship that just has a little bit of wiggle room. Right. You know, everything from you can make out with somebody on the dance floor if you're at the club and you've been drinking and, you know, it's not Armageddon, you just kissed, oh my goodness, to you can hook up with people at conferences while you're away, to you can see that ex who's in town, you know, just for the weekend, you can go reignite that, have a little fling, to seeing people as a couple, dating, having threesomes. But it's that idea of monogamish is much less demanding than polyamory. There's a lot more focus on the couple, but it's not as swapping oriented as traditional swinging, which is much more, in a very traditional sense, it's go to a club or go to a party with a heterosexual partner, swap for another heterosexual partner, and then swap back and leave with the same person you came with and never see those people again.
Right. Yeah, and I think that's important, that there are so many different ways to engage in consensual non-monogamy. And as you said, monogamish, coined by our wonderful friend Dan Savage, is just one of those ways. And it's important to understand that, you know, what are the different ways to engage in this type of relationship structure, and what are the pros and cons of them, and how do we effectively engage and help our clients and patients with those issues. Well, thank you so much. Appreciate.
Thanks for having me. This was fun.
Yeah, and I look forward to seeing more of you in future programs.
Wonderful. Thanks.
Thanks.